what I suggest is from the child is born, after that, from birth till say about the first tooth is erupting at about 6 months or 7 months. Until then, there has to be a practice where the mother or the caregiver or father, they use a piece of gauze or a soft cloth to clean the child's gum pads. Even if they have
Okay.
no teeth, just clean the gum pads after feeding. The reason being, firstly, you will clean out all the debris that is there, extra milk and all that. And also, will help for the child to have that oral stimulus. So when you introduce a brush, it's nothing new for a child. Like, suddenly something new has come in. So the child is used to that oral stimulus that is there. Once you see the first tooth being, coming out of the gums, then you should start off with a silicone finger brush. You get those brushes which you put on your fingers, and then you can use it to clean with that. So that it's a very soft silicone brush, so you can use it up on the gums also, and on the teeth, and it's not very, very harsh for the teeth. After that, like, when you think that the child is older, he's getting multiple teeth, at least 4 or 5 teeth are there, you can switch to a bristle brush, which has a small head, which is you get for kids less than 18 months of age. You get a very small bristle brush, and then clean with the bristle brush. Now, toothpaste has to be introduced as soon as the first tooth is erupted. So, according to the American Academy of Pediatric Dentistry, they suggest a rice smear or a rice grain or just a smear of fluoridated toothpaste to be used for children. Now, the fluoridated toothpaste has to be about 1000 ppm of fluoride. It has to contain that. So, this has been very, very beneficial for reducing cavities in children. 1000 ppm. The earlier guidelines, much earlier, I think about 10-12 years back, they had suggested that don't use fluoride. But using a fluoridated toothpaste has brought in a lesser incidence of decay. Fluoridated toothpaste is important to be started off. Under 3 years of age, it has to be a rice smear, a rice grain size or a smear size. And then from 3 to 6, it has to be a pea size amount. And also with the toothbrush, as the child grows, I think you can increase with the head of the toothbrush and have a bigger toothbrush.